Thanks to the Affordable Care Act, Marketplace plans cover essential health benefits like prescription drugs, preventive care, and mental health and substance use disorder services. In Congress, I've championed legislation to expand access to affordable care and protect Americans with pre-existing conditions. In March of 2019, I introduced the Healthcare Affordability Act to reduce premiums for consumers who purchase plans through the health insurance marketplace, ensuring that everyone has access to a plan that costs no more than 8.5% of their income. I'm proud to say in June of this year, 2020, my bill passed the House of Representatives as part of the Patient Protection and Affordable Care Enhancement Act. I hope that, especially given the toll of the pandemic on our healthcare system, Senator Mitch McConnell will see the wisdom of making healthcare more affordable and bring my bill up for a vote. I've also introduced legislation to get rid of the cost barriers that prevent too many Americans from accessing primary care, mental health and behavioral health care, and the life-saving medications they depend on. I'm going to continue to champion policies to reduce health insurance premiums, lower out-of-pocket costs, and ensure access to healthcare for everyone in our community. Today, I've invited Laura Pelican, Executive Director of Get Covered Illinois, and Daryl Block, the President of the DeKalb County Board of Health and the Dean of the Northern Illinois University College of Health and Human Sciences, to discuss the health insurance marketplace and why it's so important to get signed up for a plan. Throughout this workshop, you will receive helpful resources and the information that you need to navigate the enrollment process. Now I'd like to hand it over to Dr. Block to set the stage and introduce our viewers to the health insurance marketplace. What is it? Who's eligible?
Thank you. Thank you very much. The Affordable Care Act is a comprehensive healthcare reform law that was enacted in 2010. It's referred to by its long title, the Patient Protection and Affordable Care Act, the initials ACA, and Obamacare. The Affordable Care Act has three primary goals. The first goal is to make affordable health insurance available to more people. The law provides consumers with subsidies, premium tax credits, that lower costs for households with incomes between 100% and 400% of the federal poverty level. The second goal is to allow for expansion of the Medicaid program to cover all adults with income below 138% of the federal poverty level. Illinois expanded its Medicaid program in 2014, but not all states have expanded their Medicaid programs. Making Medicaid available to low-income, non-elderly adults is a key part of the Affordable Care Act's strategy to reduce the nation's uninsured rate. The third goal is to support innovative medical care delivery methods designed to lower the costs of health care generally. Now, the healthcare marketplace, also known as the marketplace or the exchange, is a service that helps people shop for and enroll in health insurance. The federal government operates the health insurance marketplace for most states, including Illinois. 14 states run their own marketplaces. The health insurance marketplace provides health plan shopping and enrollment services through websites, call centers, and in-person help. There's a special program for small businesses to provide health insurance for their employees. When you apply for individual or family coverage through the health insurance marketplace, you'll provide income and household information, and you'll find out if you qualify for premium tax credits and other savings that make insurance more affordable, and whether you qualify through coverage through Medicaid and the Children's Health Insurance Program, CHIP, that provides no cost or low cost health coverage for eligible children. To be eligible to enroll in health coverage through the marketplace, you need to live in the United States, be a citizen or an immigrant legally in the US, and you can't be incarcerated, can't be serving a term in prison or jail. The Affordable Care Act is a way to improve public health. Now, public health involves protecting and improving the health of people and their communities. Public health work is achieved by promoting healthy lifestyles, researching disease and injury prevention, and detecting, preventing, and responding to infectious diseases. I'd like to talk about 5 of the many ways that the Affordable Care Act protects public health. First and most obvious, having health insurance is important so that people don't neglect seeking needed care or needed testing. This is especially important during an infectious disease pandemic like we're experiencing now. The Affordable Care Act helps make quality health insurance accessible. Coverage under the Affordable Care Act is a critical safety net for many people who lack job-based health insurance coverage. This is critical with so many people out of work due to the pandemic. Second, the Affordable Care Act improves public health by expanding access to prevention services, such as immunizations and regular disease screening. Most health plans are now required to provide preventive health services to plan members without charging a copayment or coinsurance, even if the annual deductible has not been met, as long as those services are delivered by a provider within the plan's network. Examples include mammograms, immunizations, cholesterol screenings, alcohol misuse screening and counseling, and many others. Third, the Affordable Care Act created the Prevention and Public Health Fund, the nation's first mandatory funding for public health, and the first national prevention strategy, a development program that for the first time focuses on individual behavioral choices and the social determinants of health, such as food deserts and homelessness. Fourth, because of the Affordable Care Act, the Internal Revenue Service now requires nonprofit hospitals to complete a community health needs assessment every 3 years and report annually the extent to which they are addressing identified needs. Fifth, the Affordable Care Act requires implementation of a national quality strategy. This strategy has 3 aims: better healthcare, affordable care, and healthy people, healthy communities, which focuses on improving the health of the US population by supporting proven interventions to address behavioral, social, and environmental determinants of health. You might be wondering about the Supreme Court case about the Affordable Care Act that's been in the news this past week. The President's administration and 18 state attorneys generals are asking the Supreme Court to consider the Affordable Care Act as unconstitutional. We don't know how that case will be decided. The Affordable Care Act has been around for 10 years, and if it was declared unconstitutional, there would be major effects on the healthcare system, insurance coverage, and insurance premiums of millions of people. If the court struck down the full law, Congress would face intense pressure to restore at least parts of the law. The Supreme Court decision will likely not come about until spring or summer. If you're planning to enroll in health insurance via the Marketplace, it's advised that you do that as soon as possible and not delay. To summarize, the Affordable Care Act is a very complex law with many aspects that affect public health. Thank you.
Well, thank you, Dr. Block. I would like to now turn the conversation over to Laura Pelican, the Director of Get Covered Illinois, to introduce our viewers to Get Covered Illinois as an organization. Laura is going to show us the website and walk us through the application process. Thank you so much.
Thank you, Representative Underwood. I greatly appreciate the opportunity to share this information with your constituents. I'm going to go ahead and share my screen. And I just want to mention that some of what I'll cover will reinforce what Dr. Block had said, but I won't spend a lot of time on those slides. Just kind of reinforces the ACA Marketplace and the benefits that are available to people. So as Dr. Block mentioned regarding the Affordable Care Act, I mean, basically in a nutshell, it expanded access to coverage for millions of people who previously could not get private health insurance if they did not get a plan through their employer. The ACA Health Insurance Marketplace also allows people that qualify for financial assistance to help pay for the premiums. Another very important aspect of the ACA is that it expanded Medicaid for many people, as Dr. Block had mentioned, including adults without children, which was previously not a part of the initial act. So some of you may have heard of the 10 essential health benefit categories, and Dr. Block mentioned some of them. That's something that we'll just talk about briefly, but also another very important aspect of the ACA Marketplace plans is that it provides coverage for people with pre-existing conditions. Prior to the ACA, there were insurance plans out there where people could be denied coverage because they had cancer or other pre-existing conditions. It also eliminates annual and lifetime dollar limits, which is really important because, as you know, healthcare can be very expensive. The essential health benefits that I mentioned include some very important services, and these will, depending on each person's circumstances, some will be more important than others, depending on where you are in your life and what your health needs are. But ambulatory care, emergency services, hospitalization, maternity and newborn care, mental health and substance use disorder services, which is very important, a very important part of overall health. Prescription drugs, rehabilitative disease management, lab services, preventive wellness services, and chronic disease management, which involves your immunizations and flu shots. This is the time of year where we highly encourage everyone to get their flu shot, especially during this health crisis. Any preventive wellness that can be done is an important step in keeping yourself healthy. And then, of course, pediatric services, which include oral and vision care. So Dr. Block already mentioned who's covered through the marketplace, so I won't spend a lot of time on that, but you live in the US. In Illinois, you would need to live in the state to go to getcoveredillinois.gov. You are not incarcerated, and you don't already have health insurance through another program with your insurer. So I know this is already mentioned by Representative Underwood, but open enrollment is currently underway, and it goes through December 15th. This is the time to enroll in a plan, and you've got time now, you've got a month where you can go and compare plans, look at the options that are available, and get questions answered if you have questions prior to choosing a plan for 2021. But then the question is, can I enroll in the marketplace outside of open enrollment? There are special enrollment periods for people that if you, for instance, are currently working, and if you were to become unemployed next month or later in the year, losing your health coverage from job loss, or even moving, or getting married, or having a baby, these are all qualifying life events that will allow you to enroll in a special enrollment period. And in most cases, you have up to 60 days after that life event to enroll. So as I was just listing off some of those examples, one that's really hit a lot of people this year is losing your health coverage from job loss. We'll get into this in a few seconds, but for those people who have had a drastic change in their income, there is a chance you might qualify for Medicaid, where maybe that wasn't an option for you in the past. But these are all important things to find out when looking for a healthcare plan that can help you and your family. So another important aspect of getcoveredillinois.gov and the healthcare marketplace is free enrollment assistance. We have multiple ways that you can seek assistance with finding the right plan that works for your family and for your health needs. Local assisters can help educate you about the different types of plan coverage and answer questions to help you enroll. You can also, you can find these local assisters by going on getcoveredillinois.gov, and underneath free help, you'll see if you type in your zip code, you can find a local assister in your area. During COVID, during the pandemic, you can't go in person as would normally be the case in the past, but there is assistance by phone. You can make an appointment and you can talk with an assister that can help answer questions. Navigators is another type of assistance. Typically, if you go to healthcare.gov on the federal marketplace, which is where the plans are available for you to shop and compare, The navigators are also trained to help you find and apply for health insurance. Other areas that can help you, or agencies that can help you, are the Department of Human Services and the community health departments and health centers. There's a lot of health centers out there that do this on a regular basis to help people in their communities to find health insurance. So I already mentioned about where to find the help. At Get Covered Illinois, if you click on, this is a screen capture of the homepage, you'll see there's some menu options up above. If you click on Get Free Help, you can type in your zip code, and then there's a distance from your house. You can choose the language that you speak, and then it'll bring up a list of assisters in your area. Because this is being done by phone, it's not absolutely necessary that you have to talk to an assister in your zip code. Typically, that's more for convenience when you're doing in-person assistance. However, speaking to a local assister, they will have the benefit of knowing and understanding the plans in detail from your local area. So as I mentioned, healthcare.gov, Get Covered Illinois is the place that you would start searching for your health plan and seeing a pre-enrollment checklist, things you could be asking yourself, and understanding the types of plans that are available, what different networks there are. But then when you're ready to actually shop and enroll, you'll click on the Shop and Enroll button on our website, and that will directly link you to the federal website. And that's where you will actually be able to punch in some of your information, such as household size and income, and you can see the types of plans that are available and compare them before you actually choose and enroll in a plan. Every plan in the marketplace covers the essential health benefits that I mentioned earlier, and going through this process will help you determine if you qualify for financial help. So when I mention financial help, just so folks are aware, premium tax credits is another fancy word or words for financial assistance. They're refundable credits that help you cover the cost of your monthly payments. And they're sometimes also referred to as subsidies or discounts. Dr. Block had already mentioned the requirements in terms of income. You must be at least 100, but no more than 400% of the federal poverty level. But whether you know the numbers or not, when you punch in your information on a survey, you'll be able to get some assistance with whether or not you might qualify for help. And these PTCs are only available for plans purchased on the ACA Marketplace. So this really is a great place to start your search to find out if you can qualify for financial assistance. So then some of you might be asking, especially during circumstances this year may not be the same as they have been for you in the past, do I qualify for a Marketplace plan or a Medicaid plan? When you click on the button Shop and Enroll, prior to taking you to healthcare.gov, you'll be asked to answer a few short questions, very simple questions that basically, it's not private information. It's just asking you the number of people in your household and your household income. Based on that basic information, we can help direct you to either healthcare.gov for a Marketplace plan, or have you start with abeillinois.gov to find out if you qualify for a Medicaid plan. So I'm just going to touch very briefly on the application for benefits eligibility, also known as ABE. Many people refer to these programs as Medicaid programs. So the Medicaid application process, where you'd begin with that, and like I said, if you start at getcoveredillinois.gov and you answer those questions, if you qualify for Medicaid, it will send you to the abeillinois.gov website. And it's there that you can see all the benefits that you can apply for. So the Medicaid programs, supplemental nutritional assistance, which is also known as SNAP, and food stamps, Medicare savings program, cash assistance, and emergency medical for non-citizen residents. So it's definitely another important site to check out to see what you may qualify in terms of assistance. So I just want to touch briefly on, I mentioned already the Illinois Department of Healthcare and Family Services, Medicaid and ABE Illinois through HFS. Other agencies that can be very helpful for people at this time, at any time where you're in need of assistance, is the Illinois Department of Human Services. And those are some of the programs I already mentioned that you can access through aidillinois.gov. The programs that include the food stamps, TANF, cash assistance, child care assistance. There may be services out there that you're not even aware are available. And lastly, the Illinois Department of Public Health during this pandemic, if you need up-to-date information on COVID-related news and health information, and also test site information, you can please use this website as a resource. So lastly, I just wanted to share some of these resources that I was just describing, the websites and some of those important phone numbers, which I'm happy to share, Representative Underwood, after the fact so that you can share this with your constituents. And that is it for me.
Oh my gosh, so much good information. So I just want to reiterate for people that are watching, Dr. Block and Laura just shared a lot of great information for all of us. If you were like me writing notes down, this is great, but we're going to try to make this information available to you afterwards. And if you have any questions, you can always call our office, 630-549-2190. I believe that's right. We'll put that in the chat, the phone number for our office. But one of our favorite things to do is make sure people have healthcare coverage. So we do not want folks in the 14th to be going without this critical healthcare coverage, especially during a pandemic. So we're here to help if you have any questions. But we got some questions ahead of time. So I want to make sure that our panelists have an opportunity to address those questions straight from folks in the 14th. So the first one is from Schwabe. He says he's self-employed, or she, self-employed, and has private insurance with Blue Cross and Blue Shield, and the premium keeps going up. Just got their premium for 2021, and it's going to be $2,300 a month. Are there any resources that can help them review their current coverage, usage, and recommend better options? Laura, can you take that?
I can. So I had touched briefly about the assisters that are out there. They're certified application counselors, also known as assisters, also known as navigators. But these folks are certified and trained through the state and through the federal government to help people navigate through the plans, answer questions about how plans are different, help determine if, based on your circumstances, you might even qualify for a Medicaid program. So these people have been trained for this very purpose. Their assistance is free. And as I mentioned, you can go on getcoveredillinois.gov under, choosing free help to get some help online, or to call in, because you'll have phone numbers available to you once you type in your zip code. For those folks who you may know who don't have access to the internet and may need to call and not be able to go online, they can also call 1-800-318-2596, which is the number for healthcare.gov, to speak to a navigator that way. But I highly recommend, if you have online resources, to start with getcoveredillinois.gov.
Amazing. Okay, so the next question is from Russell. Russell says, because of COVID, he's been unemployed since March. When filling out his eligibility, he was diverted to the Illinois Medicaid program because the only source of income was from his unemployment benefits. He fully expects to resume work at some point in 2021, and he's perfectly happy to go back into the exchange, AKA the marketplace, but it's currently not an option. Medicaid is reviewing his eligibility, but no determination has been made. So how should he handle it, Laura?
So he should receive an answer from Medicaid within a few days of applying. It shouldn't take more than a week. Currently, due to the pandemic, all applicants are presumably eligible. But if you have questions and you haven't gotten a response, he can call 800-843-6154. That's the aidillinois.gov phone number, but he should hear back within a week of applying. In terms of when he is able to go back to work and he does start making an income again, and if he decides financially he can turn back to an ACA Marketplace plan, then he just needs to contact the marketplace, inform them of his change in status, and then he can switch plans at that time.
Because that would be like the special enrollment period.
Correct. Yes.
Exactly. And we
very good.
Oh yeah, all in with the ACA here. Okay. And again, Russell, if you have questions, you can also call our office, 630-549-2190. I confirmed that phone number. Okay, next question is from Mary. So Mary says that her husband will retire in January of 2021. So she will have to go on COBRA or find coverage on the Marketplace because she's only 63 and she's too young still for Medicare. So many doctors that she wants to go to require a PPO from Blue Cross Blue Shield. But today, when she submitted the question, was the first time she ever heard that a doctor could refuse to accept a Blue Cross Blue Shield PPO policy just because it's from the Marketplace. Can you answer that question and clarify, Laura?
Sure. I think we should start by saying it's important to be sure that when you're picking a plan, that both the provider is in your network. It's very important because plans do change from year to year. So you just want to make sure that when you are looking at your plan, each open enrollment period, that information has not changed. A physician won't refuse coverage just because it's an ACA plan. So that in itself is not a reason for a physician to deny coverage. But you do need to make sure that your physicians are in a network that is covered by your plan. So that can change from year to year, and that's what you need to be careful about. You also have the option to switch to a Marketplace plan before your COBRA coverage ends. So that's not something you necessarily have to do, but COBRA plans can be pretty expensive. And I know it would only save you a month's time if your plan goes through January, but now might be a good time to compare plans because you might find a better coverage option and price for you now before waiting for COBRA to expire.
Yeah, that's one of the things we advise for everybody to do, whether you have private employer-sponsored coverage, whether you're on Medicare currently or newly eligible for Medicare, or if you have Marketplace coverage, take advantage of the opportunity to review your insurance plan, make sure it's still working for you, your current circumstances, any diagnoses that you have, so that if you need to switch, you're in your open enrollment period now, which is the time to make those kinds of adjustments for both Medicare and the Marketplace. Okay, so our next question is from Jerry. Jerry says, everybody talks about affordable health insurance, but nobody talks about affordability based on income. What percentage of gross income is considered? 1%, 5%, 10%, 20%? Dr. Block, can you help us with that?
Sure. The Affordable Care Act offers that financial assistance to reduce monthly premiums. And presently, people are eligible for a premium subsidy if the premiums are over 9.78%, which let's say about 10%, you can average up, of employees' household income. And it sounds like Representative Underwood is trying to make that make that bar a little more change that bar to be a more affordable bar for people.
Yes, thank you. So the next question is Janet. And Janet asks, how do you find out about different tiers to the same prescription insurance? For Laura, can you help us?
I can. So to understand the coverage on prescription drugs, it's best to request a list of prescription drugs, which sometimes is referred to as a formulary. It's just another fancy word for prescription drug list, to find out which drugs are covered. Typically, when you look up a drug, the second column of the drug list will show you what tier they're in. If it's in your plan, it'll be on this list, and your plan summary of benefits will have a section on prescription drug costs. It should also break down your copay or coinsurance for each drug. So make sure you look up this information, and you should be able to get the information on the tiers and the prices.
Excellent. Teresa asks, why are the deductibles so high, and will there be other insurance companies to choose from? So let's talk to Dr. Block about deductibles, and then Laura about the insurance company options.
Sure. So deductibles and copays are out-of-pocket costs that you pay when you receive covered medical care under your health insurance plan. While in general, premiums have been decreasing, out-of-pocket costs are increasing at around the same rate that premiums are going down. Unfortunately, out-of-pocket costs are, so why is this happening? Well, the insurance companies each insurance company wants to make their insurance look more appropriate, acceptable to people that would be purchasing or enrolling in their.
I think we might have lost Dr. Black. Lori, still there?
I am. It looks like she's like frozen.
Yes.
Yeah.
Do you want to chime in with your response, and if we can get Dr. Black back to continue?
Sure. I was just going to say, go ahead. I think actually Dr. Black is back.
Okay, we missed you, Dr. Black. You cut off, you froze.
Okay, what did you hear?
You're talking about insurance companies marketing using premium.
Right, price. So insurance companies, so you did the whole thing about them, that they want to make themselves more attractive to people that are going to enroll in the plan. And the main thing that people look at are the premiums and not so much the deductibles. Also, high deductible plans are becoming more common in the ACA Marketplace and in health insurance plans in general. So it is really a marketing thing about that, and a marketing practice that insurance companies do. Laura?
I was just going to say, to add to that, for plan year 2021, there are 179 plans available within the state of Illinois. That does not mean 179 plans for the entire state. That varies from district to district. There are also more carriers, insurance carriers providing plans this year. Last year we had 5 insurance carriers. This year there are 8. As usual, there will be multiple plans statewide in every county, and people can go to getcoveredillinois.gov to shop and compare these plans. As I mentioned before, it's also always a good tip to use the free assistance that's available to help you navigate through these plans.
And the key to remember is that the insurance companies are required to disclose their deductible prices or the deductible level along with their premium prices as part of the summary of benefit and coverage, which everybody has access to even before you enroll, and as part of, any kind of compare documents or tools that you may use online. So I would personally just encourage Teresa to make sure to look at that deductible level while comparing plans like we talked about earlier in the conversation. So Rocky's question says, being self-employed and a real estate agent, owning my own company, I'm not sure what my income is going to be, especially in this season of the COVID-19 virus. Is there anything out there that's reasonably priced where we're not penalized for making more money? That's for Laura.
So I would say when you apply for a marketplace plan, you're going to include the amount that you think you're going to make for that coming year. For some people, especially like in the business of real estate, that number obviously can fluctuate. We're in a pandemic, so it's not your typical, what you've expected in years past. With that being said, if at some point during the year, your income level changes, whether it goes up significantly or goes down significantly, that is the time to report that change in income to the marketplace. Depending on your circumstances, as I mentioned before, you might have been in a marketplace plan and you might now qualify for Medicaid based on your situation. So that being said, if you wind up going to Medicaid at any point in time and your income goes back up, you need to report that as well, because if you stay on Medicaid at some point when taxes come, and they see that you're making more money, you will owe money back. So you want to make sure that you're just keeping up that information as your situation changes. It sounds like work, but it's important to make sure you have the right health coverage and that you're not caught by surprise the following tax year.
Thank you. So Jerry and Diane say that they have COBRA coverage through January. Can we get marketplace insurance after COBRA ends? Laura.
Sure. So we touched on this a little bit with a previous question. Yes, you would qualify, as we said, as this for a special enrollment period. But as I also mentioned before, that because you're on COBRA does not mean that you cannot qualify for marketplace coverage now. While it's during open enrollment, you may want to just compare plans, what's available through the marketplace in comparison to what's on COBRA. If you do decide to wait, because for instance, the providers and everything are already figured out for you, it gives you a little bit of time to wait to do it. You do have that 60-day window which is, like I said, a special enrollment period. So you don't have to wait till or do it before December 15th. You'll have that extra time, but I highly recommend that you look now.
And then Laura, can you just give us a quick reminder again of the website to go to begin enrollment or just to shop for plans?
Oh, of course, yes. So the website that you should visit is getcoveredillinois.gov. And like I said, depending on your circumstances and when you answer the questions, it can help direct you to the federal marketplace or to ACA Illinois for Medicaid.
Incredible. Okay, so thank you so much to Dr. Block and to Laura for joining us, giving us all of this great information during a time when we are all thinking about our healthcare coverage and making sure that we are in good shape for 2021. I'd like to thank you for taking the time to join us today. And as always, to our viewers, if you have any questions, give our office a call, 630-549-2190. Friends, do not let yourselves or family members or loved ones go without healthcare coverage. We're in the midst of a healthcare crisis, and having health insurance can provide you and your family with health security, financial security, and peace of mind through this pandemic and beyond. I can't wait, obviously, for the day that we can all be together in person again and to talk about healthcare and all these issues. But until then, please take good care of yourselves, everybody. Thanks again to our experts, and thanks to our viewers. Bye-bye, everybody. Have a good afternoon.
Bye. Thank you.